Hey, I'm Dr. Jerry Williams with Urgent Care 24/7. I want to talk to you today about depression. Uh, Really important topic, and so important that we start the conversation. The stigmata surrounding mental health in society today and in medicine is just really bothering me personally. I see patients who put off coming in for care and accessing care because they're worried about what people are going to think about them. And it's heartbreaking. And, during the COVID-19 pandemic, mental health issues have really, really risen to the top for a lot of folks. And we've seen a lot of depression, both in our clinics nationally, but I've also seen it in my coworkers. It's been a very stressful, difficult time for people in healthcare. It's been a very dangerous time, and there's been a lot of bad news, a lot of sad things, a lot of people losing their jobs, financial challenges, and the isolation of being in quarantine, and just the disruption of normal daily lives has really tipped people over into depression. And I think that it's damage that we will only start to understand much later after the pandemic. And I don't know that we'll ever fully understand the mental health crisis that the COVID-19 pandemic has caused. But I want to talk to you today about depression, because if you're feeling depressed, or you have a loved one or family member or friend who's feeling depression, or feeling depressed, and is suffering from depression, or symptoms of depression, I want to encourage you to go get seen and get evaluated, because it's so important that you get a good medical evaluation by your primary care provider, or by a primary care provider, if you're feeling these symptoms, because there are medical causes for depression that are actually very treatable, that are non-psychiatric related. For example, hypothyroidism can present with symptoms of depression, and that's we can rule out hypothyroidism with a very simple blood test. So I would encourage you, if you're feeling symptoms of depression, to please get checked for medical causes of depression right away. But also, by accessing your primary care provider, or a principal care provider, you can then access mental health resources as well. And there aren't too many good things that have come out of the COVID-19 pandemic, but one that is the wider acceptance of telemedicine has become a thing, and a good thing. And when it comes to mental health care, so many people are afraid of being judged, or are embarrassed to seek care by going to a bricks and mortar counseling, or mental health facility, or psychiatrist or psychologist office, and so they're reluctant to seek care. But now we have access to fantastic telemedicine tools for mental health and ongoing counseling, and follow up. So there are some amazing resources available now. And so, if you or a loved one or friend are experiencing symptoms of depression, please get evaluated soon, and get the help you need. In the year 2021, there's no reason to live with depression untreated. There are some fantastic treatments. And of course, if you have a medical cause for your symptoms of depression, you certainly want to get those treated right away as well. But if you're suffering from depression, whether it's an acute situational depression where your circumstances have caused you to be depressed, or whether it's just a primary depression that's an actual psychiatric illness that is not caused by circumstances, then there's no reason not to get treated in this day and age, because again, they're very safe and effective options. So, bottom line is, get help, get seen. Don't perpetuate the fear of stigmata of mental health. It's an illness just like diabetes or hypertension, and you or your loved one or friend deserve to get the best care possible, get treated for it. So I encourage you to do that. And if you're feeling depressed, you're not alone. There are people out here who are very willing and able to help you through this process and to get the care you need. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.